Welcome to our presentation. I, Nico Castellano, along with Adrian Colonio and Dalia Gomez, will be presenting to you the network of Ana Garcia's diseases, in which we will discuss how Ana's diseases sped up her unfortunate death.
So the first question is, how did Ana Garcia die? So based on all the autopsy reports, medical history documents, and given knowledge of all the diseases that Ana had, we can infer that Ana died of an ischemic stroke, which is when the brain stops receiving blood resulting from a blood clot, in Ana's case being in the cerebral artery. So this results in the death of brain cells and eventually the brain itself, leading to death. So we have a small video here summarizing what happens during an ischemic stroke.
There are four important helpful techniques in investigating a crime scene. Those four being, firstly, an EMT, which is a person who performs life support techniques to people and the right to take the corpse and confirm the death of the person. And then investigators close off the crime scene to ensure nothing in the scene is tampered with. And they take pictures and put markers on and collect important evidence. And there's also a toxicologist, who is a person who collects chemicals. Well, no, they study chemicals in a person's body. They perform tests on liquids and body samples, and the corpse is taken to the hospital for an autopsy. An autopsy is like a study to confirm the manner of how someone died by a medical examiner. And a medical examiner is like a person who checks the corpse by analyzing the organs in their body.
All right, so through methods 2 and 3, we were able to search and find evidence in the crime scene that prove how Ana could have died from an ischemic stroke. Piece 1, which is aspirin, shows that Ana was about to take this medication, which you would only take when you're in pain, so she was clearly in pain. Pieces 2 and 3, which are her blue lips and nails, show that her body was not receiving enough oxygen. Piece 4 shows that her right arm was perfectly functional, but her left arm seemed a little droopy, and droopiness is a symptom of an ischemic stroke. Piece 5, which is vomit, shows that she also had an ischemic stroke because vomit is another symptom of it. Piece 6, which is her head injury, shows that there was little circulation in her head area because there was minimal bleeding. This also shows that there was little blood in her brain at the time, which would, of course, be a result of the stroke. And finally, we have piece 7, which was her EpiPen. So she probably thought that she was going into hypoglycemia, which is little sugar in her blood. Therefore, she tried to inject insulin into herself.
So Ana was suffering from many diseases, but there are 4 main ones that influenced her death, some killing her more than others. These diseases were diabetes, sickle cell anemia, UTI, and heart disease. But if we want to list those in the order that killed her from most to least, it would be heart disease, diabetes, sickle cell, and UTI. We will introduce each disease in this order, as well as talk about how they contributed to Ana's death in their own way and altogether.
Okay, what is heart disease? Heart disease is a range of diseases that affect the heart and cardiovascular system and can be treated with different types of medications and diets, depending on the disease or diseases you have. If not treated, heart disease can lead to heart attacks, heart failure, and death. Some heart diseases Ana had included hypertension, elevated blood pressure, atherosclerosis, which is when the walls of your blood vessels narrow from high cholesterol, among many others. Ana was not monitoring her heart health properly, however, making heart disease an important factor in her death.
So now we'll move on to Ana's heart disease complications. She had atherosclerosis in her cerebral artery, so that artery was more narrowed, and this makes it more likely that blood could not flow to the brain. Ana also had many blockages in her left coronary artery. This led to her elevated blood pressure and made a heart attack a lot more possible for her to have. This also means that it was possible for Ana to have blockages in her cerebral artery and other parts of the brain. And finally, high levels of fat and cholesterol in the blood made her blood a lot thicker and harder to pump, which elevated her blood pressure and made it more difficult for blood to get through the narrowed cerebral artery.
So what is diabetes? Diabetes is a group of diseases caused by the pancreas, which is the organ that produces a hormone, making little to no insulin, which is that hormone in charge of giving glucose, in other words, sugar, in the blood to hungry cells so that they can stay up and running. Without insulin giving her cells any sugar, it stays in the bloodstream, keeping her blood sugar levels high. Diabetes doesn't have an exact cure, but can be controlled with regular doses of insulin, as well as the aid of a diabetic educator, who is a person who treats and teaches diabetics on how to manage their condition, or a dietitian, a person who creates custom diets for people based on their conditions. This disease is really serious as it can cause blindness, hearing loss, kidney failure, among other deadly conditions if it is not treated properly. Anna was a type 1 diabetic, as seen by the graph, where the red line representing the levels of insulin stayed at 0 the entire time, where her blood sugar, which is the blue line, stayed high. So it was hard for Anna to control her condition since she didn't have any insulin in her body. So it would be naturally harder to keep her blood sugar levels low, but she made really bad choices in her diet that complicated her diabetes, as shown as her food diary. So Anna kept a food diary to monitor what she drank and ate, and she didn't eat really well during her last days. She consumed foods that were high in carbohydrates and sugars. As we can see, during the last few days of her life, she ate whole wheat bread, which is really loaded in carbs, low-fat foods, which consequently have more sugar in them, Coca-Cola, pizza, ice cream, marshmallows, and Oreos. But the point here is that Anna was not taking care of herself and suffered deadly complications from her diabetes that influenced her death ultimately.
Okay. As a result of Anna's bad eating habits, she developed a list of complications that led to her death. Because her high blood sugar was high due to her poor diet choices, not enough exercise, and the lack of insulin, her blood was thicker than usual. With thicker blood clots became more likely, and her left kidney suffered from necrosis because of nephron damage from the excess sugar. The kidney counts as the body's blood cells and creates a hormone that makes the bones produce more. Since her left kidney wasn't working anymore, the right kidney struggled to count all of Anna's blood, and her bones wouldn't create more blood cells, therefore lowering her blood count.
Now we'll move on to sickle cell anemia, which is a genetic disease inherited from one's parents. People with this disease have red blood cells that are misshapen into a crescent-like appearance. These sickled blood cells are more likely to clot in small arteries or in veins more than a normal blood cell would. These irregular cells happen to die earlier than a regular shaped one also. This leads to a shortage of red blood cells. This condition has no cure. However, it can be treated through blood transfusions and medications, and the moderation of a hematologist, which is someone who would analyze your blood samples.
Anna's sickled blood cells happen to die earlier than her red blood cells, therefore causing a low blood count with a hematocrit, which is a percentage of all red blood cells, to be 20%, when the normal average is around 40%. Since these blood cells tend to carry oxygen around the body, the low amount of blood cells, as well as the inefficient blood cells, will cause a shortage of Anna's oxygen supply, as the blood responsible for taking oxygen to the body has shaped the head, make it more likely to get caught with each other and clot in any narrow blood vessel, making blood clots and stroke more likely to happen.
Now we move on to the disease that affected Anna's death the least, which is a UTI. A UTI is short for a urinary tract infection, which is when a bacteria enters the urinary system. Symptoms can include fever, fatigue, painful urination, among others, and this disease can be treated with antibiotics after diagnosis. Anna had contracted an infection from the bacteria S. marcescens from a catheter she had from a recent hospital visit caused by sickle cell crisis.
Now, Anna wasn't taking care of herself on the last days of her life, so her UTI developed complications that affected her health. As a result of her UTI, her white blood cell count went up. These high white blood cell counts made clots more possible because white blood cells are bigger than your red blood cells. Her UTI may have spread to her kidneys, causing damage to them. Also, Anna's antibiotics for her UTI didn't allow her to take her hypertension medication.
Anna was taking many medications for all of her diseases, and some not as a necessity. Some of these medications interacted with each other in a way that made Anna's conditions more dangerous than they already were. Antibiotics for Anna's UTI didn't allow her to take her ACE inhibitor, and due to these antibiotics, this led to uncontrollable hypertension. Excessive dose of statins led to increased levels of blood sugar, and consuming 3 glasses of wine a day also increased her blood sugar. She attempted to inject herself 4 times on the left leg to lower her blood sugar, but this had failed, which didn't bring her blood sugar to a safe zone. She took aspirin in attempts to soothe a headache resulting from her ischemic stroke, but was slow to thin Anna's blood.
And now we'll just kind of do an overview between the relationships of her diseases. Her sickle-shaped cells made the blood more likely to clot, and atherosclerosis narrowed her vessels and the cerebral artery. So that means that some of the oddly shaped cells got caught and caused a clot in the cerebral artery, and therefore the stroke was able to occur. Anna's blood was also very thick from her elevated levels of blood sugar, making it more likely for the stroke to occur. The sickle-shaped cells made the blood more likely to clot, and with the thick blood, a clot was able to form in the cerebral artery. Anna's blood has a honey-like consistency from her high levels of blood sugar, and Anna's atherosclerosis in the cerebral artery and high levels of fat in the blood made it more likely to have a clot, and therefore the ischemic stroke. As a result of infection, Anna's immune system was making many white blood cells, which added to her total blood count. The sickle-shaped cells made the blood more likely to clot, and the many larger white blood cells caused a clot in the cerebral artery. Also, as a result of infection, Anna's immune system was making way too many white blood cells, which added to her total blood count again. So her poorly controlled diabetes made her glucose levels higher than usual, and therefore made her blood thick from all the sugar, and along with the elevated number of larger white blood cells, this caused a clot in the cerebral artery. And her UTI caused her immune system to create more white blood cells also to fight the bacteria. And these cells, again, are larger than red blood cells. Her atherosclerosis and high levels of fat and cholesterol that stuck to the walls of her vessels in the cerebral artery made it more narrow and harder for regular red blood cells to get into the brain. The fats and cholesterol that stuck to her walls made it harder for the white blood cells to get through and caused a clot in the cerebral artery.
So we know how Anna's diseases affected her death individually, but now it's time for us to look at the bigger picture and see how Anna's diseases killed her altogether in a simpler way. So we created a model to show in a simpler way of how Anna's heart disease, diabetes, sickle cell, and UTI caused her ischemic stroke and ultimately killed her. So those are the red blood cells. Those are the white blood cells, which were larger. And these are the sickle cells. There are two types of blood that are in the jars. And they both have different characteristics and consistencies that make them different from each other. So the one on the left is Anna's blood, and the one on the right is the healthy blood. The healthy blood is more runnier, while Anna's blood is thicker and goopier from the high sugar content. So we're going to do a run with the healthy blood and cerebral artery. And as you can see, the healthy blood is more runnier, so it's going to get into the brain with no problems through the cerebral artery, which is perfectly fine. And as you can see, all of the blood goes to the brain. So now we're going to do a run with Anna's blood and cerebral artery, which are affected by her diabetes and heart disease. So Anna's blood is thicker than usual, and it's gonna go slower, and it's gonna get caught in the narrowed part, which contains all the fats from her high fat and her atherosclerosis. So as you can see, this model shows how risky it was for Anna with heart disease, diabetes, sickle cell, and UTI to get an ischemic stroke that would ultimately kill her.
Okay. Anna goes to the hospital resulting from a sickle cell crisis and contracted a UTI. This won't affect her until later, however. 5 days later, she was discharged from the hospital, and she woke up one day and didn't take her medications and took very poor dietary choices. Her blood sugar got high because of this. Anna got a fever as a result from the UTI, and a brain malfunction from the lack of blood. And as Anna's blood is still high in sugar, this resulted in it getting thicker, but she went to sleep normally. As she slept, white and sickled cells and thick blood developed a clot in narrowed cerebral artery, and she woke up with a headache and dizziness from the sudden lack of blood cells. She took an aspirin, but as the clot worsened, she fell and hit her head, and the left side of her body drooped as a result from the stroke. Anna is suffering from ischemic stroke, which leads to death of the brain and of the other organs. And Anna's heart stopped as a result from brain death, and she died.